progression. Is that you? Is that your program I heard about, the second one? And what do you have? What do you have to? How do you respond to that? Are you aware of these things?
So the answer to the second question is easier. It's no. It's not me. About green tea or anything, other things. There is no dietary supplement known to improve the condition of Alzheimer's disease. So that includes green tea or anything else that you may read about.
Are there any ongoing clinical trials, or are you planning any clinical trials of your vaccine at least in Down syndrome patients?
Okay, I will answer that, but I want to remind you that there are very two good neurologists to my side. They actually know what they're doing. So, you are welcome to address questions to them as well. As for clinical trials, can you hear me?
No. Yes, hold it closer.
As for clinical trials, research in my lab is preclinical, which means it's been done on animal models. To take something such as a vaccine such as that into clinical trials it can take up to 10 years. Okay? So I don't know when we will begin it, but I hope we will begin it one day. There's no way of telling when and how it will be done. It's so complex to do that. Yeah, that's the best I can tell you. It's not up to me, let's say that.
Are there any physical symptoms as these cells are dying and multiplying and so on, like a little twitch in the head or anything of that nature?
Probably not. Later on, individuals with Alzheimer's forget to do some of their usual tasks. People even forget how to walk, and forget how to coordinate a meal, forget how to put on their coat. But early on, one wouldn't really see any physical symptoms. I want to comment about diet, the Mediterranean diet, although hardly a cure-all, and that's fish and olive oils and whatnot. It's better to eat a Mediterranean diet than to not eat one. It's somewhat better. It hardly prevents Alzheimer's. It hardly cures it, but people who eat that diet seem to do better than people who don't. So that's a little something in that area.
I'm a caregiver and a psychometrician by training, and I'm wondering, kind of skeptical, how you're going to measure cognitive declines in the elderly, especially once you get into mid and later stage dementias. Short of using mice and mazes, well, you could do something like that in the equivalent.
I can say, well, we have, clinically, there's different ways that we do it. It's not in any type of study, but when we see someone with Alzheimer's, we do a basic neurological examination with them at the bedside. And there are other tests that we do. People can go to neuropsychologists for a formal 3 or 4 hour neuropsychological evaluation. We have a computerized test in our office. It's similar to the ones that they give high school kids when they're playing football before and after they've had a concussion. So it's this computerized test that we have that someone comes in there, it takes about 30 minutes, and it divides your brain, if you will, into judgment, memory, visuospatial, how you see the world, executive function, how you multitask, and you get it compares your answers to a database of people your age and your education. So you compare it to someone your age who, as opposed, an 18-year-old, a 22-year-old graduate from MIT isn't compared to a 95-year-old who didn't go to school, and you get a score. And what happens is, oftentimes it makes the person feel better that they've had a normal score. You get to see where your peaks and valleys are, and then 6 months later, a year later, you can do the test again and see if there's been any decline or not. And if there's been a decline, that speaks more for them having a dementing process, whereas if there's not a decline, there probably isn't. So that's one of the tests that we use.
If I understood you correctly, that at this point, physical exercise and I guess a cognitively enriched environment has the potential to delay Alzheimer's to some extent.
physical exercise, I think is pretty clear. What would constitute a cognitively enriched environment?
Well, yeah, it's a good question. To translate our findings from the lab into humans, right? That's the question. How do you translate so let me tell you what it is in a mouse, for a mouse. Mice are typical. Louder? Okay.
Keep the mic close.
Okay. Everything is okay. Baruch Hashem. So, how do we do environmental enrichment in mice? Okay, so control mice will be mice that spend in the same cage, same boring cage, with no particular features on it throughout their life. Okay, now an enriched environment for these mice will be a bigger cage with more mice around it. Okay, so that's social enrichment. It will have various, you can call it toys or structures, different colors, different patterns on them. Okay, not one material, different materials, and that constitutes for environmental enrichment in mice. So you can imagine if you translate it, and that works now. Okay, so you can imagine that if you translate it to humans, enriching your social, okay, and other experiences such, well, in a way it's increasing your input through your eyes, through your ears, okay, through your nose. I can tell you what to read or where to go, but in general you need to increase those activities. Okay? No one can tell you exactly what to do because these things can hardly be measured in humans. I can take someone, enrich its environment, then slice its brain and measure, did it work? We cannot do that, but we can make an educated guess. That's really what I can tell you. Now I have a question to my friends here. We spoke earlier about those tests for MCI, for example. Why not use, tests for MCI as a screening tool for the population? If it's so sensitive and it can tell whether a person starts to deteriorate or decline in its cognitive capacity, why not administer it to the population? It's surely cheaper than imaging, complicated imaging.
Yeah, right. So if you there would be nothing better for my office than if everybody came in and just had this test. So it can work like that, unfortunately. This goes to the bigger question of what happens when someone comes to our office and truly has dementia and has Alzheimer's, right? Or even more so, now that there's fancier imaging tests that aren't commercially available and aren't fully recommended, but will be available within a few years, that you can tell that somebody may get Alzheimer's disease. I mean, it comes down, it's been with a lot of diseases in medicine over time. Do you want to know this? Do you want to know that you have a disease that right now there's no treatment for? Do you want to know if you found out, heaven forbid, that you are getting Alzheimer's, but you don't know if you're going to get it? So if everybody found out they're getting a disease in a year, we would all take that proverbial trip around the world and do all that. But if you find out you're getting a disease and it might be in a year, but it might be in 20 years, what are you going to do about that? Do you really want to know? And back more relevantly, if someone has mild cognitive impairments, and that's the stage in between normal memory loss and getting dementia or Alzheimer's disease, the medications that we use are somewhat helpful. They're hardly cure-alls. They make it a little bit better. So we are all for trying to identify patients as early as we can and starting them on medications. So if we could screen everybody and start them, we'd be happy to do that, but I don't know how practical that is.
I have one question. Enrichment, I can understand. More reading, going to theater, being in an orchestra. Physical exercise, is just weightlifting sufficient? Must it be aerobic? What type of physical exercise is the most effective for the goal of mental health?
That's an excellent question, and we don't all have treadmills in our house, nor can we run on them if we do have them. So some of the clinical trials have shown that exercise that focuses on balance and coordination is key to also helping enrich our brains. So I really endorse things like yoga, Tai Chi, anything that really focuses on balance and coordination has been shown to be actually very helpful for two reasons. One, for potential, and there's no good clinical trials saying it prevents cognitive decline, but there's some really good data showing that it prevents falls. And as we heard from our speaker, and I'm sure we all have a personal experience of knowing someone who fell, broke a hip, and then was never really the same. So really a lot of it is just to focus on fall prevention. And again, if you are sort of having issues around balance, there's also some pretty good benefit from physical therapy to focus on gait and balance training. So if you've never asked your physician to give you a prescription for gait and balance training by a physical therapist, our physical therapist here would love for you to ask for that to be done.
I'd like to follow up on Dr. Allweiss's comment about the medications that are being prescribed, like Aricept, Amanda, Exelon. I find a care manager, a geriatric social worker at the Jewish home, the Jewish Home and Home, and I'm interested because once the patient is put on these medications, it seems as though they stay on the medication for years and years and years, and no one knows if it's benefiting them. So it is, and no one knows really ever if it's ever benefited them. And it's a big business, you know, as far as the medications, the pharmaceutical sales. Could you all comment about that?
Right. So there's two groups of medicine. So we'll call Aricept in the first group, and then there's Namenda, which alone is in the second group. And you start the Aricept first. The problems with that medication are it's better once you start it. You don't want to stop it because people have a decline after they stop it. So people are on it indefinitely. It's not a medication that makes you better than you are now. So there's no people, if you're looking to get better from it and you're on it, that's not going to happen. The confidence has to be that if you're on that medication, you're doing better than if you weren't on that medication.